Dani, hello, and welcome to ACT podcast by the Integrated Health Services Project. Let me introduce you for our audience. So you are Dani Mothci from the International Alliance of Patients Organizations. This year you celebrated the 25th anniversary of IAPO. What an achievement, and congratulations. You are an organization that amplifies patient voices globally. So to celebrate your milestone of the organization, but also to celebrate you being here in Kosovo, let's have a conversation about patients' voices, and what we can all do to amplify these voices. Thank you, Dani, for agreeing to be part of this podcast.
Oh, thank you so much, Linda. It's such a pleasure to be here today.
So, Dani, we will talk about initiatives like the Universal Health Coverage Compass that you launched in December 2024. Also, what each actor can do to ensure that these initiatives leave no one behind. My first question for you relates to your organization, the International Alliance of Patients Organizations, celebrating its 25th anniversary. So you mark a quarter of a century of championing patient voices globally. Could you share how your mission and initiatives have evolved over these years? But first, can you share with us, how did you join the IAPO? What made you start working in the fields of patients' rights and patient voices engagement?
So I moved to the UK 12 years ago to do a master's in social policy. And then I had the opportunity to work with IAPO. And it was the concretization of a lot of the work that I was already doing back in Brazil, where I come from. And there I worked for many years with civil society organizations and supporting them on the ground with the work that they were doing. But also for a long time, I worked with populations in vulnerability and how they could be included in policy making. It wasn't only on health. The focus was in every sector of the local government in Rio de Janeiro. And we were working together with the residents and the communities of these vulnerable areas, where we were discussing what were their needs, what were their preferences with regards to the services and policies that the local government was offering. And it was so transformative for me as a person, but for the government as a whole, because they lived in such particular context that the policies and services that were offered for the rest of the city, for the formal city, didn't work out for the informal city. So learning about the richness of considering the lived experience of these people made everything better and more effective, and also helped us address the fragmentation of some policies. So that experience really changed me as a person and as a professional. So when I came across IAPO, the opportunity to work with member organizations, patient organizations from all over the world, and support the work that they are doing, but also take in consideration their lived experiences, that felt the right thing to do. But talking about IAPO, IAPO is an international alliance of patient organizations. We have almost 300 member organizations from all over the world and across all disease areas. And our work is to mobilize and support these patient organizations and empower them to play a more active role in decision making as they're shaping the global health landscape. So we are not working directly with patients. We work with the patient organizations that are supporting patients on the ground. And our Our work has changed a lot in the past 25 years, and I was reflecting a lot about this recently because of this 25th anniversary, which is a huge landmark. And when IAPO started, it was more about this group of patient organizations who got together because they realized there were so many decisions being taken at the global level and they were not part of it. So it was more about raising awareness and trying to find a way in these discussions, but also with time, it became an advocacy work, a very strong work to ensure that the patients were more have the rights that they were. It was more the work turned into more advocacy because they were advocating for better patients' rights. But with time, the work of IAPO evolved to a lot of collaboration and collaborations not only among patient organizations, but with other key stakeholders. And we started to be part of very important discussions about global health, regional health, and sometimes national health. And I think this shows how much our journey has changed. We are there to raise awareness. Still, we are there advocating a lot. But a big part of our work evolved to the collaboration. And I think that is bringing more impact to the work that we are doing. And for us to be prepared for these collaborations and also for us to involve our members in these collaborations, we do a lot of capacity building and support the work of our member organizations. So we empower them with the tools that they need to do the work that they do on the ground.
So Dani, after almost 8 years with IAPO, and all the experience you have with the organization, the impact of the organization so far, what is your vision for its future?
I want IAPO to be present in any sort of discussion happening at the global level related to patients and patient organizations. We are working tireless for this to happen. We have a very active role at the World Health Organization, but also other UN agencies. But there's so much more happening around there. And I want us to be considered the point of reference for any patient organization all over the world that needs any kind of support for the work that they are doing. I want to keep empowering these organizations to deliver better services, better information, better support to the organization, to the patients that they work with.
On 11 December 2024, IAPO launched the Universal Health Coverage Compass to empower patient organizations. How does this tool work? How is it expected to impact patient involvement, especially in holding governments accountable for achieving universal health coverage?
So the UHC Compass was developed throughout this year, 2024, with the big aim of empowering the patients or organizations on the ground to advance universal health coverage. Because we know that we have this mission to achieve the Sustainable Development Goals by 2030, 5 years ago, and we are not yet there. A lot of discussions happening at the global level on how we achieve that and so on. And we realized that patient organizations, they weren't given the space that they should be given in these discussions. But to support all these global efforts and partnerships that are already in place to advance universal health coverage, a group of patient organizations, the Global Patient Think Tank, developed the UHC Compass, which is specifically to support patient organizations on the ground. And what's unique about the Compass? It's because it's not only, it's a tool, It's at the moment it is an interactive PDF, but we are going to digitalize it and make it even more friendly for the organizations to use. But it's a tool that has knowledge about UHC, everything a patient organization needs to know, based on other documents, very important, developed by key organizations like UHC 2030 or the CISEM, the civil society arm of the UHC 2030. But it's not only about knowledge. There is a part of the compass which is about helping the patient organization understand how their main agenda relates to UHC, how their priorities relate to UHC. And this is a very important point because UHC sometimes looks like such a big topic, so scary, so hard to achieve. And not all organizations understand that they are already doing a lot to do it, to deliver it. So another part of the compass is to understand what is the expertise and the capabilities of this organization. So it's a readiness assessment. And based on that, they understand how much they need to improve and level up their game, or how much they're already doing well to advance UHC. And finally, there is another section of the UHC compass, which is with a wealth of case studies, other resources from other patient organizations, best practices, and so on. So it's a very, very comprehensive tool and practical. This is the main thing. There's so many toolkits around there, so many really interesting, important, effective toolkits, but sometimes not so friendly, not so practical. And the UHC Compass, the little that we have already applied and tested, because it was not only developed by patient organizations, but also tested by other patient organizations from all over the world. The feedback that we received was incredible about, wow, I didn't realize how much I was already doing to advance UHC, or wow, I didn't know that this specifically is a way that I could be chasing my country to achieve better care. So this kind of feedback and how empowered they feel after using it, and also to engage with the government to discuss how to advance and hold governments accountable to invest more in healthcare. So this kind of feedback can be, just in the beginning, it was already very exciting. So I cannot wait to hear more about other patient organizations using it.
Indeed. One day after launching the UHC Compass, you also attended a big event in Kosovo, marking the Universal Health Coverage Day, which was quite a pivotal moment for patient voices in Kosovo. So from your perspective, how can patient organizations in Kosovo play a significant role in advancing the UHC agenda locally? What would be some of the global lessons or initiatives that Kosovo can draw upon to make these efforts successfully in their local context?
That's a really interesting question. I believe that one of the main things that patient organizations need to do is to get together, to collaborate among themselves, have a united voice when they are engaging with the government or other key health stakeholders. And I'm not talking about them giving up of their main agenda because they work with a specific condition. I'm just talking about them collaborating and thinking about priorities for the patient community as a whole in the country. And bringing together these voices. Also understanding who needs to be there, who is missing, because sometimes we know there are some organizations that are stronger, they're more, they have more experience, more expertise. But on the other hand, there are other organizations that can benefit from collaborating with the more experienced organizations. So, and they should be taken in consideration. in any sort of collaboration, because with different voices, we have more richness, we have different perspectives, and we can learn from each other. Then have a clear plan. How you want to engage with the government and hold the government accountable if you don't have a clear plan. What a successful universal health coverage means for you in this country. So you have to understand what are your priority as a patient community. And then also prioritize this in a way and be flexible with any sort of collaborations and discussions with the government. Aligning government priorities with the patient community priorities can be a struggle for many, many reasons, which I want to get into detail here. When you have priorities, you have a clear plan to discuss with the government, who's the main player in delivering universal health coverage. Even though it should be a collective effort, it's a whole of society effort. And when you have this conversation with the government, be open to discussions, to different perspectives, but also keep strong in your negotiations. Don't give up. And monitor any promises, monitor any decisions, and be there holding the government accountable. But remember to report back everything to your own community. Keep them informed about what was discussed, about what was agreed, and also keep engaging them. And continue, because needs change, institutions change, the context changes, and you have to be open to all of this. But I truly believe that if you connect as a group, and I've came across this great initiative here in Kosovo, PRAC, the Patient Rights Association of Kosovo, joining forces with other patient organizations and signing a memorandum of understanding so they can have a unified voice when discussions about UHC and other health related topics are held. So amazing work and very inspiring. With regards to examples, it's so important as an international organization to keep reminding everyone that there is no one size fits all. No matter how successful one initiative is in one country, it doesn't mean that it's automatically transferable to another place, because it's a different context, there are different people, different institutions and governments. But of course, we can learn from them, we can adapt and see how it goes in different ways. I always refer to an example from my own country, because I think it's an amazing initiative, which is the participatory health budgeting, and the fact that citizens, patients, they can be part of the planning of the health budget. They can make decisions about what are the priorities, how the money is going to be allocated, and they have a role in monitoring it and monitoring the implementation. And I think, not saying it's perfect, not saying that it's super effective, but it's a great way of engaging and having the patient voice there in the government.
The World Health Assembly resolution on social participation in 2024 is a game changer for patient communities worldwide. How do you see this resolution influencing the work of patient organizations globally?
I think this resolution is a one in a lifetime. When I heard about it in the beginning of the year, I quickly changed one plan that IAPO had for a side event at the World Health Assembly in May. We were going to talk about another topic, and then I said, no, we are going to talk about the role of patient organizations in advancing universal health coverage and how this resolution can make a big change. And seeing this being approved is a dream coming true, because I cannot see the world surviving without us who are the health users, making decisions together with the government on how policies and services are going to be delivered and implemented. And this social participation resolution is a key. What it says is that it's of course, it's a political agreement, we know, but it's such a big step to have all member states of the World Health Organization saying, we believe social participation should be institutionalized. We believe that we will be held accountable, because accountability is a big thing in this resolution. Member states will have to report back and say how they are engaging civil society, patients, people with lived experiences, and communities in health. Also, it's coming, this resolution is coming, this moment where there is a big global effort to advance UHC. So one agenda is supporting the other and feeding into the other so well. So I think it's not an easy task, because not all countries are ready to implement it, but I'm very hopeful about what it can achieve. And this resolution is just, when we talk about social participation, not everyone understands the meaning of social participation. But one thing that I can reassure, this is all the patient organizations are doing. We are part of working groups or advisory committees in the government or in the Ministry of Health. This is social participation. We are part of the participatory budgets, or we take part in public consultations, or we co-design services. This is all social participation. So we, patient organizations, we have been doing that, but now it's the time to institutionalize it. Now it's the time to monitor it, but also to finance initiatives that support social participation. So I think it's a game-changing moment, definitely.
Coming back to Kosovo and our region in the Western Balkans, collaboration seems to be at the heart of what IAPO does, from regional hubs to collaboration with the World Health Organization. Starting from this point of what IAPO does, what can local patient organizations do to learn to introduce global advocacy efforts into their local realities, into their local work?
So the reason why IAPO was created is because a group of patient organizations realized that there were so many discussions happening at the global level that they were not part of it. And of course, these discussions were affecting their work on the ground. And why I'm saying that is because this is still a reality in some way. We are part of these discussions each time more. However, how they trickle down to the patients on the ground, this is still a big challenge. And one of the main things that IAPO is investing our work in is how to unpack everything that is happening at the global level, those global health policies that can have an impact in the countries where these patient organizations are based. And also, how they can hold the governments accountable with regards to the political agreements that they are making at the global level. So it's a two-way path. How do you say? It's a two-way path. But again, we have to remind us that what works globally needs to be adapted to the local context. And any guidelines, they have to be carefully reviewed in a way that they truly fit the reality on the ground. And this is a very hard task, much of the time, this is a hard task because when the decisions are made at the global level, they don't take into consideration the needs and preferences of those who are on the ground. So it's a challenging thing. But also because sometimes when these decisions are made, they take so long to get back to where they should and to be implemented, that momentum has changed, context has changed, and this is also challenging. But that said, this is the difficult part. The good part is the global perspective is good because we can learn from different experiences. We can learn from different countries' experiences, from different organizations, and we can partner.
Thank you, Dani, for your wonderful insights and information. It's clear that patient voices are key drivers of accountability, inclusivity, and progress in healthcare. As we look ahead to 2030 and the goal of universal health coverage, this conversation with you reminds us that collaboration, innovation, and persistence are the keys to leaving no one behind. Thank you so much, Dani, for sharing your expertise and for all the incredible work you and IAPO do.